Heart failure is a complex and progressive condition characterized by the heart's inability to pump blood efficiently to meet the body's metabolic demands. It is a significant global health problem affecting millions of individuals worldwide. This introductory video provides an overview of heart failure, including its definition, causes, pathophysiology, clinical presentation, diagnostic methods, and general treatment approaches. Understanding the basics of heart failure is essential for recognizing its clinical features and initiating appropriate management strategies. Definition and classification. Heart failure refers to a clinical syndrome in which the heart's pumping ability is compromised, leading to inadequate circulation of blood and oxygen to vital organs and tissues. It can be classified into two main types: systolic heart failure and diastolic heart failure. Systolic heart failure involves impaired contraction of the heart muscle, resulting in reduced ejection of blood. Diastolic heart failure occurs when the heart muscle becomes stiff and fails to relax properly, leading to impaired filling of the heart chambers. Systolic heart failure is also referred to as heart failure with reduced ejection fraction, HFrEF, as well as systolic dysfunction. Diastolic heart failure is also referred to as heart failure with preserved ejection fraction, HFpEF, as well as diastolic dysfunction. Congestive heart failure, CHF, is a condition characterized by the heart's inability to effectively eject blood received from the venous system. It is a prevalent diagnosis among individuals over the age of 65 and encompasses various types. The most common type is left-sided heart failure, LHF, followed by right-sided heart failure, RHF, and biventricular heart failure, involving both the left and right ventricles. There is also a less common type known as high-output heart failure. In LHF, blood accumulates in the lungs, resulting in pulmonary congestion. On the other hand, RHF causes a buildup of blood in the systemic venous system. Causes and risk factors. Heart failure can result from various underlying causes and risk factors, including 1. Coronary artery disease. The most common cause of heart failure is coronary artery disease, which leads to reduced blood flow to the heart muscle due to narrowed or blocked coronary arteries. Coronary artery disease occurs when the coronary arteries, which supply oxygen-rich blood to the heart muscle, become narrowed or blocked due to the buildup of fatty deposits called plaques. The narrowing of these arteries restricts blood flow to the heart, depriving it of oxygen and nutrients. Over time, the reduced blood flow can lead to damage or death of heart muscle cells. This damage weakens the heart's ability to pump effectively, resulting in heart failure. 2. Hypertension. Prolonged high blood pressure can strain the heart and eventually weaken its pumping ability, contributing to heart failure. High blood pressure, also known as hypertension, is a condition characterized by persistently elevated blood pressure levels. When blood pressure remains high over time, it puts increased strain on the arteries and the heart. In the context of heart failure, chronic high blood pressure can have detrimental effects on the heart. Here's how it happens. Increased workload. High blood pressure forces the heart to pump blood against greater resistance, requiring it to work harder to maintain adequate circulation throughout the body. This extra workload gradually weakens the heart muscle. Cardiac remodeling. The increased workload on the heart triggers a process called cardiac remodeling. In an attempt to compensate for the increased demand, the heart muscles may thicken, hypertrophy, and the chambers of the heart may enlarge. While these changes initially help maintain cardiac output, they eventually impair the heart's ability to pump effectively. Reduced coronary blood flow. High blood pressure can lead to the narrowing and hardening of the coronary arteries, coronary artery disease. This restricts blood flow to the heart muscle, depriving it of oxygen and nutrients. The insufficient blood supply can weaken the heart muscle and contribute to heart failure. Overworked and damaged heart. Over time, the constant strain on the heart caused by hypertension can lead to damage in the heart muscle. This can result in a decreased ability of the heart to contract effectively and pump blood, ultimately leading to heart failure. 3. Cardiomyopathies. These are diseases of the heart muscle that can be inherited or acquired, leading to structural abnormalities and impaired cardiac function. Cardiomyopathy refers to diseases of the heart muscle itself. There are three main types of cardiomyopathy that can lead to heart failure. Dilated cardiomyopathy. This is the most common type of cardiomyopathy. It involves the enlargement, dilation, of the heart chambers, particularly the left ventricle. The heart muscle becomes weakened and stretched, reducing its ability to pump blood effectively. Over time, this can lead to heart failure. The causes of dilated cardiomyopathy can vary and may include genetics. Some cases of dilated cardiomyopathy are inherited, resulting from gene mutations that affect the structure or function of the heart muscle. Viral infections. Certain viral infections, such as myocarditis, inflammation of the heart muscle, can damage the heart muscle and lead to dilated cardiomyopathy. Alcohol abuse. Long-term excessive alcohol consumption can weaken the heart muscle, leading to dilated cardiomyopathy. Drug abuse. The use of certain drugs, such as cocaine or amphetamines, can contribute to the development of dilated cardiomyopathy. Hypertrophic cardiomyopathy. This type of cardiomyopathy involves the thickening of the heart muscle, particularly the walls of the ventricles. The thickened muscle can obstruct blood flow out of the heart and impair its pumping ability. In some cases, the heart muscle becomes stiff and less compliant. Hypertrophic cardiomyopathy is often inherited, resulting from genetic mutations that affect the proteins responsible for muscle growth in the heart. The thickening of the heart muscle reduces the chamber size, impairs the filling of the ventricles, and compromises the heart's ability to pump blood effectively. This can eventually lead to heart failure. Restrictive cardiomyopathy. In this type of cardiomyopathy, the heart muscle becomes stiff and rigid, restricting its ability to expand and fill with blood during the relaxation phase of the cardiac cycle. As a result, the heart's pumping capacity is reduced, leading to symptoms of heart failure. The causes of restrictive cardiomyopathy can include infiltrative diseases. Certain diseases, such as amyloidosis, abnormal protein deposits, or sarcoidosis, abnormal immune system response, can infiltrate the heart muscle and make it stiff. Storage diseases. Disorders like hemochromatosis, iron overload, or glycogen storage diseases can cause abnormal substances to accumulate in the heart muscle, leading to stiffness. Radiation therapy. Previous radiation treatment to the chest area for cancer can damage the heart tissue and cause restrictive cardiomyopathy. In all types of cardiomyopathy, the impaired ability of the heart muscle to contract effectively or relax properly compromises the heart's pumping function. This results in symptoms such as fatigue, shortness of breath, fluid retention, and eventually, heart failure. Treatment approaches for cardiomyopathy and heart failure focus on managing symptoms, addressing the underlying cause, and improving heart function through medications, lifestyle changes, and, in some cases, surgical interventions like heart transplantation. 4. Valvular heart disease. Malfunctioning heart valves, such as aortic stenosis or mitral regurgitation, can lead to increased pressure or volume overload on the heart and eventually result in heart failure. Pathophysiology. Heart failure is characterized by a cascade of pathophysiology changes that occur in response to the heart's reduced pumping capacity. These include neurohormonal activation, inflammation, ventricular remodeling, and impaired cellular energetics. These processes further exacerbate cardiac dysfunction and contribute to the progression of heart failure. Clinical presentation. Heart failure can manifest with a variety of symptoms, which may include 1. Fatigue and exercise intolerance. Reduced cardiac output leads to inadequate oxygen delivery to muscles, resulting in fatigue and limited exercise capacity. 2. Shortness of breath. Accumulation of fluid in the lungs, known as pulmonary congestion, can cause breathlessness, especially during physical activity or when lying down. 3. Edema. Fluid retention in the body can lead to swelling in the legs, ankles, abdomen, or other areas. 4. Cardiac-related symptoms. Patients may experience palpitations, rapid heartbeat, or chest pain, depending on the underlying cause. Diagnostic evaluation. Diagnosing heart failure involves a combination of clinical assessment, medical history review, physical examination, and diagnostic tests. These tests may include electrocardiography, ECG, echocardiography, chest X-ray, blood tests, and cardiac catheterization. Congestive heart failure encompasses the failure of either the left ventricle, right ventricle, or both. It commonly manifests with symptoms such as dyspnea, shortness of breath, and edema, fluid retention. To differentiate heart failure from other conditions that may also present with dyspnea or edema, the measurement of B-type natriuretic peptide, BNP, levels can be helpful. BNP levels tend to be elevated in heart failure and can aid in distinguishing it from conditions like asthma, acute coronary syndrome, chronic obstructive pulmonary disease, COPD, or pulmonary embolism. Treatment approaches. The management of heart failure aims to improve symptoms, enhance quality of life, prevent disease progression, and reduce morbidity and mortality. General treatment strategies may include 1. Lifestyle modifications. Patients are advised to make lifestyle changes such as maintaining a healthy diet, managing fluid and salt intake, engaging in regular physical activity, and avoiding tobacco and excessive alcohol consumption. 2. Medications. Several medications are prescribed to alleviate symptoms, reduce fluid retention, control blood pressure, and improve cardiac function. For compensated heart failure, these may include diuretics, angiotensin-converting enzyme, ACE, inhibitors, beta blockers, and aldosterone antagonists. For decompensated heart failure, treatment options include diuretics, vasodilators, and inotropic agents. Starting beta blocker therapy during acute decompensated heart failure, ADHF, is not recommended due to the acute negative effects on heart muscle contraction. However, once patients are in a stable fluid balance, euvolemic, it is safe to begin beta blockers at a low dose before discharge. In fact, studies have shown improved outcomes in patients who were initiated on beta blockers prior to discharge. 3. Device therapy. In certain cases, devices such as implantable cardioverters, defibrillators, ICDs, or cardiac resynchronization therapy, CRT, may be recommended to improve cardiac function and prevent life-threatening arrhythmia. 4. Surgical interventions. In advanced cases, heart transplantation or mechanical circulatory support devices may be considered. Let's do a brief recap of what we've covered so far to solidify our learning. Heart failure is a clinical syndrome characterized by impaired cardiac pump function, leading to congestion and inadequate tissue perfusion. Common symptoms include dyspnea, orthopnea, and fatigue, while signs may include an S3 heart sound, rales, crackling sounds in the lungs, jugular venous distension, VD, and pitting edema. Systolic dysfunction, known as heart failure with reduced ejection fraction, HFrEF, is characterized by a decreased ability of the heart to contract and eject blood, resulting in an increased end-diastolic volume, EDV. This type of dysfunction often occurs as a result of conditions like ischemia/myocardial infarction or dilated cardiomyopathy. Diastolic dysfunction, referred to as heart failure with preserved ejection fraction, HFpEF, is characterized by impaired ventricular relaxation and reduced compliance, leading to an increased end-diastolic pressure, EDP, and preserved EDV. Myocardial hypertrophy is a common cause of diastolic dysfunction. Right-sided heart failure most commonly occurs as a consequence of left-sided heart failure. COR pulmonale refers to isolated right-sided heart failure caused by pulmonary condition. Treatment approaches for heart failure vary depending on the underlying cause and type. Medications such as ACE inhibitors, ARBs, angiotensin receptor neprilysin inhibitors, beta blockers, excluding acute decompensated HF, and aldosterone receptor antagonists have shown to decrease mortality in HFrEF. Loop and thiazide diuretics are primarily used for symptomatic relief by promoting fluid excretion. In select patients, hydralazine with nitrate therapy has been found to improve both symptoms and mortality. Conclusion. Heart failure is a complex syndrome characterized by impaired cardiac function, leading to symptoms of fatigue, breathlessness, and fluid retention. Understanding the definition, causes, pathophysiology, clinical presentation, diagnostic methods, and general treatment approaches of heart failure is crucial for early recognition, appropriate management, and optimization of patient outcomes. Further exploration of specific types of heart failure will provide deeper insights into their unique characteristics and targeted therapeutic strategies. Watch our video on the subtypes of heart failure to learn more. Thank you for watching, and be sure to talk to your healthcare provider if you have any questions or concerns about your medications and any health conditions you may have. Disclaimer, the information presented in this video is for educational and informational purposes only. It is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you have heard or seen in this video. We would like to express our gratitude to our sponsor, First Cup Coffee, the original seed, for making this video possible. Shop firstcupcoffeeusa.com. First Cup Coffee, the original seed, is dedicated to providing high-quality coffee that fuels your studies and work with a rich and invigorating taste. We appreciate their support in bringing you valuable, free educational content. Remember to visit firstcupcoffeeusa.com for your daily dose of exceptional coffee. That's a wrap for today's lesson on heart failure. I hope you found this video informative and helpful. If you have any questions or topics you'd like us to cover, let us know in the comments below. Don't forget to like and subscribe to our channel for more educational content. Take care, stay healthy, and I'll catch you in the next video.